You don't want to miss this video. We all know that 83,000 jobs, or 15% of the VA workforce, is on the chopping block. We've been told that time and time again. And Secretary Collins has promised veterans, that none of these cuts will involve frontline healthcare workers. Well, that's not the case. This video is Mark Takano. He's on the House Committee on Veterans Affairs, questioning Secretary Collins about a leaked document with plans to cut thousands of frontline healthcare workers, doctors, psychologists, social workers, nurses. And Secretary Collins doesn't deny the document. He gets upset and he refers to the document as a leaked pre-decisional document. And so I want to briefly unpack that analysis, the nonsense before the video. A leaked document, that just means he didn't want us to know about it. Of course, he's embarrassed about it. Now, the pre-decisional aspect of that's basically bureaucratic spin for a plan, and it just sounds better than a plan. So basically, we have a leaked plan, and you don't get a pass. The intent was there. It's kind of like you go hire a hitman to kill your spouse, and you accidentally hire an undercover cop. You can't say, hey, I didn't go through with it. It was just a pre-decisional decision. Just because you get caught before you pull the trigger doesn't mean the intent was there. And I think this is rather telling of Secretary Collins, that he blames the leak, he attacks the line of questioning, he talks down to Mark Takano. And I'm curious as to your opinions. If you could please leave your comments in the comment section. And we'd appreciate too if you subscribe to our YouTube channel and you like us. And we're going to be bringing more of these hearings your way in the next couple of weeks. So we appreciate it.
Ranking member.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being here today. Mr. Secretary, you've testified that, quote, no one has discussed firing doctors or firing nurses, end quote. No one has discussed this. And that the 15% figure floating around is just a goal, not a directive. Then I need you to explain this spreadsheet that I have behind me. And we're handing you a copy of this spreadsheet. It was circulated by your own reorganization implementation cell. It asks VA staff to calculate the savings from a 15% cut to every VHA position, including frontline clinical roles. And it says cutting nearly 4,000 nurses, for example, would save $1 billion. Cutting 400 psychologists, another $110 million. The list goes on: health aides, pharmacists, housekeepers, etc. Now, if your testimony is true, that no one is looking at plans to cut these jobs, why did your team ask for this analysis?
Ranking Member, I'm looking at this right here. This is exactly why we're here. This is a leaked pre-decisional document that is not helpful, and it is not working, because here's the end of the day. I'm going to answer this.
Claiming my time, Mr. Secretary. It's my time.
Well, it's my answer.
You have said publicly that no one has discussed. That would be interpreted. No one has discussed this at all. But we have a document, whether leaked or not, that establishes that these cuts are being discussed.
I said that I have made clear we will not be cutting frontline health care. If they're
but
working
your subordinates are discussing this. They must have gotten the direction from somebody.
They did. Well, I've been very public. It's just like your staff. If
Okay,
they want to talk
well,
about something
you can
that you don't know
understand
about.
why there's a lack of credibility from the public on this sort of
There's
stuff.
a lack of
This is
credibility
not
for this.
speculation, Mr. Secretary. It is a VA document. We have asked your head of HR, Mark Engelbaum, for answers. We've actually asked your subordinates about this. He promised a follow-up, and we never got it. So I'm asking you now, on the record, why did your team request this analysis, and what are you preparing for?
Well, if I have to explain this in a way that makes sense, let me just say this. If you
Don't talk down to me, sir. I'm just asking you a question.
I'm just answering your question. If you let me answer it, I'll answer it.
Please, time is ticking.
This right here is an overlook of our entire organization to see. What they did here is fine. Whatever they're looking at is fine. But when it comes to the Secretary of VA, which is me, and the direction that we have given to make sure that health care is prioritized, to make sure that our veterans are getting the desire that they need. And when I've told you that when we're talking about this and exempted 300,000 positions, that is what happens at the VA.
Okay,
Can they have other conversations that involve other things? Possibly so. But
thank
coming
you.
from me, it's not.
Okay, well, thank you. Let's move on.